A new advisory out by the U.S. Surgeon General details how drinking alcohol can increase the risk of developing 7 types of cancer. It also comes with a call for Congress to require warning labels on alcohol, informing people about the link between cancer risk and alcohol consumption. An oncologist with the Norton Cancer Institute weighs in on alcohol consumption and the risk of developing breast cancer, one of the 7 cancers on the Surgeon General's list. Details in tonight's look at medical news.
The information we have regarding alcohol and breast cancer has been very clear for many years. These were epidemiology studies where they had large groups of women with diagnosis of breast cancer. They would match them up with what would be, quote, community controls, which would have equal age, potentially equal other risks of cancer, looking for other things that could be going on that's different between those two groups that might be predictors of breast cancer. And alcohol comes up clearly. Any alcohol versus none. The any alcohol has a higher risk of breast cancer. But even when you look at small amounts, there's an increased risk of breast cancer, and it increases. So a little bit of alcohol on a daily basis is an increase. But it's even higher if there's an excessive amount of drinking, 2 drinks a day, something like that. But again, information we've known for a long time. I think it's particularly concerning in patients that are at higher risk with other types of risk for breast cancer. Obesity, for instance, weight. Patients that may have a family history, for instance, would be another group. But I think it's important for women to know. And it's important that I think with many other things in life, alcohol, safe in most patients, and it's just moderating consumption. Small amounts, things like that would be my recommendation in terms of reducing risk of breast cancer. I do see some patients that have pre-breast cancer that come to me to look for reducing risk, and that absolutely is on the top of my list, is to keep alcohol to a minimum level. I typically write it out as 1 or fewer alcohol drinks per day, emphasizing the fewer, if at all possible. And in all my breast cancer survivors, we've actually have guidelines, and it does appear that even in a breast cancer survivor, perhaps some risk, but probably safe for a moderate single drink per day or less. I don't think we can speculate that taking 1 month off and then going back to a moderate to a significant amount of alcohol per day, probably in the big picture over the next 5-6 years in a person is not as important. But I think perhaps knowing and finding out that, gee, my month that I really was not consuming alcohol at all, where normally I was having a drink or 2 every day, gee, you know what, I kind of feel better. I sleep better. We all know it's counterintuitive. Many people think a way to get a good night's sleep is to drink alcohol. It's the other way around. But they find out they're sleeping better, they're feeling better, they're functioning much better and quicker at work. I think overall that'll only be helpful if a patient would like to try that.
The other cancers linked to alcohol consumption: colorectal, esophagus, mouth, liver, throat, and voice box.